My name is Mariah, and I'm a therapist here at Salt Lake Behavioral Health Intensive Outpatient Program. Bipolar disorder is characterized by an individual that may experience manic highs and depressive lows. Bipolar disorder is extremely disruptive not only to your life, but to those that you love and care about and spend the most time with. You may be experiencing mania if you find that you go days and days without sleep, that you have excessive energy that you can't burn off. If you suddenly find yourself, or someone you love, very distracted with sounds that sound similar, and that leads to illogical speech patterns or pressure to rapid speech or thoughts. Manic episodes often are also characterized by risky behaviors such as excessive gambling or spending or grandiose thoughts. Someone may decide to take their shoes off and hike barefoot across the entire country overnight. These may be signs that you're experiencing or someone you know is experiencing mania. Manic highs and depressive lows are extremely difficult to navigate on your own and without medical or psychological assistance. Many times, those with bipolar may not be aware that they are experiencing manic episodes because their thoughts and their behaviors seem logical to them in their elevated state. If someone that you love seems to be experiencing mania, or if people who love you are telling you that your behaviors may be manic, it's a good idea to come in and get checked and evaluated, as bipolar behaviors can result in very long-term damage depending on how long your mania lasts. When the pendulum swings the other way and a person with bipolar experiences a severe depressive episode, it can feel like you can't get out of bed. It's very disabling and may last several weeks. It's difficult to find motivation to do even the simplest of things. The swings between the manic highs and the very depressive lows can feel disabling, confusing, and inconsistent to you and to the people you love. Depression treatment is the same whether in bipolar or in other situations, and we know a lot about how to process through and act counter to those depressive feelings and symptoms. And if medication is needed, in IOP, we're able to provide that too. Bipolar is extremely treatable. That's the good news. Between medical and psychological interventions, we've seen many people experience normal, well-balanced lives. Treatment for bipolar, primarily in the outpatient setting, is treated with what's called DBT, dialectical behavioral therapy. Through DBT guidelines, those with bipolar are able to mitigate and manage their behaviors and swings and fit them into an everyday life schedule. Studies have shown that as many as 2/3 living with bipolar 1, which is the bipolar disorder that experiences more severe mania, are able to live with the disorder without being disabled by it. This provides a message of hope for anyone who may be experiencing bipolar or loves someone who does experience bipolar. We encourage you to come in and be part of our program so that we can help you achieve the equilibrium that you're looking for.